My mic's off as well. Interesting.
Yeah.
It mutes you when you come in. Okay, good stuff.
Do we need to make sure that the volume is turned on for presenting? Because sometimes that's a feature, isn't it?
Let's have
Doesn't
a look.
come on automatically.
Include sound. Yeah, Millie, do you want to make sure? Yeah. Cool. Okay. Shall I admit everybody who's in the lobby? Get us started?
Yeah, sounds good.
Sounds good. Fab.
I'm just calling Sam and Liz into the meeting because they're not quite in the room yet, are they?
I see Liz,
Yeah,
but I can't see Sam.
I'm here.
maybe Sam's in the.
He's in the ether
sign-ups.
somewhere.
Yeah. Stuck in limbo.
Shall I let everybody in and then we can work out where Sam's gone? Sounds good. Okay, I'll admit all.
One.
Okay. Welcome, everybody. Great to see you all. You're all so organised. I love it. So, hi and welcome to the presentation today that Sam, Jack and Millie are going to be putting on for us. So, golf as a therapeutic activity. If everybody's comfortable to, if you want to just pop in the chat your name and your role, where you're located, if you feel comfortable to do that as well, just to kind of introduce ourselves to everybody. And we'll keep doing that just as people join. Okay. Stuff. So just as people are joining, we're just popping our name, maybe your job title, or where you work and where you're located just into the chat, just to introduce everybody. It would be lovely if we could go around and introduce ourselves, but we've realised there's quite a lot of people with us today, which is fantastic. But that means it would take us a while to get around everybody. So I think probably the chat's the way to go today. Oh, Lisa, you're almost finished. Fantastic. Amazing stuff.
Good evening.
Oh, and just as sorry, I think somebody's just unmuted. Sorry, did somebody have a question? There's just a bit of feedback noise maybe. So we're just popping our name and job title and locations just into the chat to introduce ourselves, just as everybody's joining. So we'll give it a couple of minutes and then we'll get started. It looks like we've got a proper MDT in the chat. This is amazing. We've got physio students, social workers and OTs. Brilliant. Fantastic. So just as extra people are joining, we're just popping our name and our location and where you work into the chat just to introduce ourselves. We're getting ready for the golf as a therapeutic activity presentation, which I haven't seen this presentation yet, so I'm excited to see. Suzanne, did you have your hand up? Do you have a question?
Yeah, just to apologise that it says chat's only available during the meeting, so it's not allowing me to type at the moment.
Same with me. So it's the same with me, and we're from the same organisation. So
interesting. So there's a couple of us who are struggling to type into the chat, but it only seems like there's a couple of us for whom that's the case. Okay, let us just have a fidget about with the settings. Bear with us. Thank you for letting us know, Suzanne. Sorry, for those who are just joining, we are introducing ourselves in the chat if you're able to access it. So we're just putting our name and where you're located and your job title and whatever you feel comfortable to share. And we're just trying to work out why some people can't see the chat. Tech gremlins, hey.
I have just changed something for the chat.
Do you want to just
Okay.
try again and let us
Okay,
know if
so-
you can use it?
It still says chat's only available during the meeting, so I can see the messages, but I can't actually type anything myself. So that's nothing's changed there for me. So I can try leaving and re-entering if you want.
Try again. I think I've turned the chat off for everybody now. Have I?
I had the same issue and I've re-entered, but I
Let's
continued
go.
on the browser rather than using a Teams app, and that seems to have worked for me.
Okay.
I've changed it to all 3 settings and it doesn't seem to have made a difference.
Okay.
Well, I'll tell you what, I'll give the ideas board link. Oh, I can't even put that in the
Yes.
chat though, can I? Oh, you can access the
You-
chat, can you?
You'd be able to see it and maybe
You can
copy and
copy a link.
paste.
Okay,
Yeah,
let's do that.
because it sounds like people can see the chat, they just can't type into it. Is that right? Thank you for bearing with us, everybody, and our lovely tech gremlins. So for
So-
those who just joined, we're typing our name and location and job title into the chat just to introduce ourselves, but we're aware that some people can't type into the chat right now. So Liz is just posting a link into the chat that you should be able to click on, and then you'll be able to just add your details onto that. Thank you, Liz. Stuff. We'll give it one more minute before we get started, because we've got a few more people joining. Okay, good stuff. So just to let everybody know, we are recording the session today. It's always great to see all your faces. So if you want to keep your cameras on, that would be fab. I completely understand there may be things going on in the background. You may see small children running past me in the background. Don't worry if that's the case. Whatever's going on in the background is fine. So yeah, just we'll just make sure that we're recording and that everybody's in. Okay, I think we're good. So to give a quick schedule for what we'll be doing today, we'll be giving a quick introduction to the Moving OT's community of practice and how that kind of links in with our kind of wider context in the OT practice and leisure and physical activity industry. And then we'll have our fantastic OTs, Millie, Jack and Sam, come on to do a quick presentation for us. After that, we'll have time to discuss that presentation in small breakout rooms, and then we'll come back together for a bit of a final chance to ask questions. So I'll introduce myself because I've realised I've been talking at you quite a lot and I haven't actually introduced myself. So I'm Lisa Westhorpe. I'm an occupational therapist working in the national and strategic spaces for Sport for Confidence. I'm going to tell you a little bit about Sport for Confidence and our community of practice. So Millie, do you want to share the slides? We can get those started. Lovely. So our presentation today is going to be on the therapeutic value of golf and the fantastic resource that our OTs have put together. And I'm going to start by giving a little bit of an introduction to Moving OTs. So I'll start off by telling you a bit about Sport for Confidence. So we're a community interest company. We're tackling health inequalities by providing those opportunities to access physical activity and really empowering people who might be experiencing some of those barriers to participation. We are a no labels model. So you might say, well, what does tackling health inequalities look like in reality? And our traditional model is placing occupational therapists and coaches into leisure centres to provide those opportunities to access physical activity. So that might look like one-to-one interventions, it might look like groups and different sessions. It can also include things like our long COVID and primary care provision as well. So as you can see from the slide, we've became a Sport England system partner almost 2 years ago now. So we received funding to share our learning from our delivery sites with a wider audience. So taking that local learning and sharing it nationally. And Sport England are a government funded body who invest in the sport and physical activity arena. So the quote on there is actually taken from Sport England's Uniting the Movement strategy. So that's a 10-year vision that's going to transform lives and communities through sport and physical activity. And that's their mission. Interestingly, in that document, it talks a lot about inclusion, equity, removing barriers, increasing engagement and participation, accessibility, that collaborative approach. So basically, when I read that, I was like, this is the language of occupational therapy. It's music to our ears as OTs. So there are, it shows there are real parallels between occupational therapy and the sport and physical activity sector, and that OTs can and should be involved because we have that, brilliant link between occupation and health and our knowledge around that. So our Moving OTs community of practice, this is our inclusive space where we are sharing knowledge and ideas about how we can promote physical activity within our occupational therapy practice. So really promoting that value of meaningful physical activity. So obviously, we want to promote physical activity as part of occupational therapy practice, as part of the community of practice, and we're moving towards that health equity and occupational justice. Those are issues that we're wanting to address, and we want to support other OTs to be able to do that. So I think I've probably talked at you enough, and that's a bit of a background basically about our Moving OTs community of practice. I've been talking for too long, so basically I think it's time for me to introduce amazing OTs who are going to give you a fantastic presentation today. So we have Jack, Millie and Sam, and I'll let them introduce themselves.
Hello, my name is Jack Samways. I am a senior occupational therapist who's employed to work on the Golf and Society Research Project here in Sheffield, and I've been working with my colleagues Millie and Sam to co-produce the guide with research participants and also occupational therapists and physiotherapists who attended some of our co-production sessions back in January.
And I'm on Spotlight now. I'm under the limelight. Oh no! I'm Millie. I'm one of the OTs working at Sport for Confidence. I've been collaborating, working closely with Jack on delivering this project, but then also to create this resource and do the co-production sessions as well. I'll hand over to Sam.
Thank you. We should have figured out who was doing that in order. We were all just kind of waiting for who would go first. My name's Sam Studder. I am occupational therapist with Sport for Confidence, working for the national team. I have been helping contribute with Jack and Millie on the creating the guide, and I was supporting a number of students with long arm supervision on the Golf and Society project. And it's lovely to see a few of the students who we work with here today.
So without further ado, we're going to play the presentation. So it is pre-recorded. The sound should be loud enough, but if anyone does have any issues with the sound, please just let us know. I'm not quite sure what we can do about it, but we can see what we can do in the background. So here we go. This is the guide.
Are we having some problems with the presentation?
Sorry, can people hear that? I've got a message in the
Yeah.
chat saying that it wasn't.
I can't hear anything.
Oh, I can.
Yeah, I can as well. Interesting.
It's
Could
not
you not
playing
hear it
for
either,
me.
Jack?
It's not playing at
Hang on,
all.
I just forwarded it, so it is now.
So, Lisa, nothing's happening for me. If anyone's struggling to hear, adjust the volume on your laptop. I can hear. Okay, shall I press play again and see what happens? I can
Yeah.
only see a handful of people on the screen. Right.
That was fantastic. Can I just say that? Thank you, everybody.
Thank you.
That was really a really great presentation and covered a lot of the themes that we saw within the guide that's been developed. And we now plan that we'll go into some breakout rooms just to discuss some of those themes. Millie, did you have some questions that we're going to talk about? Fabulous.
Is there any?
I'm copy them into the chat. Sorry, Liz. I was just going to try and copy these into the chat.
The breakout rooms are ready to go. I haven't been able to add the facilitators to each of the groups, and I don't know where we're going to end up because it's not obvious. But I'll try and manage that as we go. And I just wondered whether there were any general questions for you before we do that. Great presentation, by the way. I don't know if you want to stop sharing.
Yeah, happy to answer any questions if there are any. David?
Who has their hands up? It's listed under David.
Sorry, that is me. That is me. Sorry, everyone's sitting there blankly. I had a problem with my laptop and I'm sitting on my husband's laptop, and you now know what his name is as well. I'm so sorry. Yeah. I'm now David. It's Sue. Hello. Sorry. Fantastic presentation. I do have a question. And yeah, that sort of initial going into golf clubs, as you say, that's sort of traditionally sort of elitist, exclusive. You know, what sort of experience did you have going in and, you know, making those connections? Have you found that challenging?
In terms of the research project, I think we were very lucky because we worked with Golf in Society, who have already established connections with golf clubs who understand the value of working with different populations.
Okay.
But
so do golf clubs sort of register with Golf in Society, or how do you find out who's got a connection with that already?
I think Golf in Society have got there's a number of locations. I know that there's other people in the call that might be better positioned to answer how to engage with the golf clubs, and we have put a section in the guide about strategies for doing that. I think there is still some elements of some environments just aren't particularly accessible and there's not understanding. So often in my role, I was required to do an environmental assessment and then to sort of discuss with the clubs how to adapt the environment, what the session requirements might be. And sometimes that was a discussion where we were really having to advocate for the people that we were working with. But I wouldn't say that's particularly any different to any of the sort of sport environments or any kind of community environments. There's always that role of advocacy, isn't there? And I'm aware that Nat Matchant is on the call and may be able to add a little bit more. I don't want to put him on the spot, Nat, but I think Nat is a golf club owner and occupational therapist. So welcome any feedback from her.
Hi, thank you. That was an amazing presentation, by the way. I'm so excited to see it all. It looked incredible, just everything, the information, the layout, the research, what you've put into it. So yeah, I really can't wait to read that. But yeah, you said it there really, Jack, I think. And yeah, Golf in Society themselves, I've reached out to Anthony Blackburn, the founder. He's just like amazing, as in he's just so kind, and he should have been an OT in real life. So he's so approachable, and I think on his website he's got how to connect with him, regional managers as well, I think, and even into Wales and Scotland. And I think they do recruit and engage with different golf clubs that are suitable to sort of run his sessions for those with dementia, Parkinson's, etc. And myself as a golf club owner, I can also register with Anthony, which we're in the process of doing actually, to become a site to look at hosting those sessions that Anthony runs. But certainly what Jack touched on, yeah, not to repeat perhaps what's in the guide, but certainly what I find is that golf club managers, honestly, it's just like the NHS, and we have things that will be put on our desk that we have to face, kind of like you guys do around sustainability, accessibility, and we have governing bodies like England Golf and RNA, they're called, that drive these kind of things and push these initiatives and governance. And so they're eventually going to land on our doorsteps. Really, we have to do something about them. We're a little bit behind the NHS in that kind of way, but and most golf club managers, you know, they're busy in the summer months, which I know is, but it's hard to underestimate that with the weather. So I think approaching golf clubs, anything between September to March, they're a bit more open to listen, I would say. They're less busy. And I think the GMCA is one of the best things that Jack mentioned there. So Golf Club Managers Association is like a professional body, a bit like CSP or RCOT, and that we're part of as golf club managers, and it's national. And then I'm part of the regional East Midlands one, and they have monthly meetings where they do like CPD, and they get speakers from different charities. And we had one from the Bird Society and how we can make our golf courses more sustainable. We had a paramedic come and talk on it about mental health, first aid. So if you ever wanted to kind of like get in and do a talk and introduce OT or physio, I would get in touch with the regional managers, and they have a website as well.
Thank you very much. Thank you.
Thank you now. Do we have any more questions? Roberto? I hope I've got that right.
Huh? Anna Maria.
Oh, Anna Maria. Apologies.
Okay. Yeah. I do have a question because it's not clear. Probably you have on the site this one, but I just want to see if you have how people can join to it. It's a referral form. You have some criteria for it, or do you hear me?
I didn't quite hear the question. If someone else did, could they pick it up?
So it sounded like Anna Maria was asking about referrals and how referrals come in to Golfing Society or the project that you were working on.
Yeah.
So Golfing Society have got a taster session booking form on their website. They also have a map of the localities they work in. So if you have the details of someone who you want to refer, you can fill that in, and then they'll get back in touch with you about an opportunity to come down and see what's happening at one of their local clubs.
Okay, thank you.
You're welcome.
Fantastic. And Eve?
Yes, sorry. Hi. That was a really great talk, so thank you. I am not able to access the chat function, so this is more of a question for just like if we can have a copy of the guide in email form or some sort of form, that would be fantastic. Yeah.
So the guide is going through final. I feel like I'm jumping in to talk all the time, but anyone else feels free to do that. But yeah, the guide is just going through the last final checks and edits. So as soon as that's all done, we will make it. We'll put it on the website, and you can access it there. And so it'll be on Sport for Confidence, and I imagine it'll be on Golfing Society's website as well. Okay. So yeah.
Thank you.
And I think we have a question from Amy as well.
Hiya. Thanks for that. That was really good to listen to. I was really interested. I really liked the communication tool that you developed, and noticed it's a bit different to any of the other guides that you've produced. I just might have missed it in your talk, but can you talk through why you developed it?
It was an idea that came out of discussion with myself and Millie, and I think we just recognised that, and also I think from the co-production sessions with the physiotherapists and OTs, that often engaging people in a conversation about physical activity is hard enough, and then with sport being already stigmatised, with golf already being sort of stigmatised, there's an added barrier. So there was a need to be able to break down those perceptions about golf and just introduce it in a way that was really accessible, so that you could there's words and pictures on the tool, so that people might identify with one or two elements, and that will generate conversation. And then obviously the copy in the back of the guide then supports the facilitator to link to the content or the evidence that can then be used to sort of carry on that engagement, to facilitate that conversation in a more meaningful way. And I think many of the participants we had in the project, their feedback was that their initial reaction was, oh no, I'm not sporty, or they had just this visions of dragging golf bags up massive hills, and we needed to really challenge that, because obviously what our experience of golf is perhaps isn't necessarily what the traditional perspective of golf is. It's about a very adaptable sport, something that can be tailored to individual needs, and can be incredibly engaging for different communities, and also builds a sense of belonging, giving people their occupational identities back in many cases. So yeah, we just wanted a different format to engage people in that, and make it accessible to everyone.
Thank you. That's a really good idea, because I think you could probably adapt that to other contexts as well, with sort of the stigmatization around a lot of different types of sports. So yeah, I really liked it. Thank you.
Brilliant.
Fab. I can't see any other hands up, so I'm wondering if we want to go into our discussions within the breakout rooms.
So I've just dropped some questions into the chat. So these are questions which ask you to think about how you're going to use this information in your practice. So if everyone can have a discussion in their groups, we will try and join the groups ourselves, and we'll see you in there. Have we been transported into the breakout rooms?
Looks like some of us have.
Maybe this is our breakout room. Yeah. We're all in the same one.
You are being transported, but it didn't give me an option to transport any of us.
I think we just need to pick the rooms.
Okay. Yeah, okay.
Has everybody else had some kind of notification to click on about the breakout rooms? Or are some people no?
Oh, yeah,
okay.
So there we go. We just click now on the side of any of the rooms. So if Lisa, if you click on room 1.
Where are they?
Rooms, aren't there?
Where are they?
Can you go to rooms at the top?
Rooms, yeah.
Rooms.
Oh, okay.
Can you see the list of rooms there?
Yes.
So if you go in room 1, if you see the 3 dots, and I think you can self-assign.
I can join. Yeah. Okay, I'll go in room 1 then.
Are we doing the ideas board?
Yeah, but it's only for notes, and yeah. And Jack, do you want to go in room 2?
Yeah.
Sam, room 3, and Millie, room 4, and I will go to room 7.
And we're coming back at 25 past. Give them 10 minutes or 20 past.
Maybe 20 past.
20 past. Yeah, give us a bit of time to discuss after.
Yeah.
Okay. Liz,
And
you're
if
going
we
to call
can't-
us back in.
I'll call you back in, yeah. And if we can't access the questions, we'll just encourage conversation.
Yeah.
About
No worries.
Yeah. Right.
Right, see you in a minute.
Yeah.
Millie, are you
thing, you know? So kind of sprung to mind.
Sorry, everybody. I'm pulling everyone back into the breakout room, into the main room.
Yeah, not category. You know what I mean?
There we go. We got everybody back. Hopefully nobody's lost in the ether.
Are we all back in the room? We've got 27. I think we might have lost a few people along the way.
Hopefully they're on their way back.
You nearly lost me on the way back. I couldn't figure out how
Yeah.
to get back in.
Okay, so we've got 5 minutes or so just to feed back as a group about our discussions. I mean, I know in our group we could fill 5 minutes with all the things we discussed, but I wonder whether we just want to go round quickly and highlight a few points from each group. I don't know if were the groups numbered. Should we start with one and go through? Does anybody know what group they were in? No. Okay, cool.
I'll go in a minute. Can I just ask one thing?
Yeah, sure, go for it.
Put my son to bed now. We were just getting to the point of talking about how people got to the project, and it was funded by the Golf Society for the duration, I'm guessing. But I was just wondering, like, after that finished, then what happened in terms of people continuing to engage in golf and how they could do that?
That's really interesting because myself and Liz were actually on a call with Anthony, who runs Golfing Society, was it yesterday? And he was telling us that a lot of the participants who were involved in the project were actually at the golf club that he was at that day and were, you know, engaging in the same things they'd kind of, you know, carried on with that occupation since the project had finished. And Liz and I were just sitting there going, yay, that's amazing. So yeah, that was really nice to hear from him, that they have stayed in touch and they are continuing with that. So,
and is it pricey? Is it expensive? Because I know, like, my last placement was in Bristol after stroke. They had a thriving walking football, but it was like they had to pay for it, but it was kind of like £3 a session. But even then, everything that everything that was organised, cost was a major factor. £3.50 is like the maximum somebody could afford to do something. And I'm wondering, continuing golf, like, how much does that cost? I've got no idea. But it seems like, you know, might be a lot, but I don't know. And the equipment and stuff.
Absolutely, yeah. I'm wondering whether Jack or Millie wants to jump in.
I'm happy to jump in. As far as I know, since the programme is finished, the cost per session for a 2-hour session is £10. I know that access to the centre was one of the bigger barriers, and that Golfing Society have established links with Sheffield's community transport to facilitate access, you know, to organise regular access. So I think there's £10 for the session, and I think it's something like £6.70 or £6.80 to get to and from the venue each week. So yeah, it just pushed the price up a little bit, and I think cost is always a factor. But in terms of what they're accessing, it does offer a lot of value.
Cool, thank you.
So before we go, I'm really aware of time. It's 28 minutes past. I just wanted to highlight a couple of things. So first and foremost, thank you so much to the contributors to the co-production events, both practitioners, OTs, and physios, all of the students that we've had to help contribute toward the guide. Thank you so much. It's been invaluable in helping to shape this resource. And of course, thank you to all of our participants who've been involved in the project. As part of the CPD event, we have created a CPD certificate for you to be able to access. You can access this by going through this QR code on screen, or this Google form. It's going to ask you to fill out a Google form, which just asks a few questions about how you're going to use the information that we've shared in this event today, and just to capture a bit more information to keep you up to date and so on and so forth. I will put the link in the chat now so that people can access this, and it will automatically send you a CPD certificate when you've finished it. I'll hand back over to Lisa to finish off if there's anything else that I've forgotten.
I think we have a couple of hands up, so I'm wondering if we just want to go round and answer any questions before we go, because I am mindful of people's time and not keeping people too long. Did anybody have a question? I think there's a hand up. Eve?
Yeah, sorry, just another request as well. I know this is being recorded, so it would be great to have access to the recording if that's possible.
Absolutely. So the recordings are posted on the YouTube channel for Sport for Confidence. So that should be up in the next couple of days. So yes, don't worry, there will be access, and we'll make sure that the recording is linked in any emails that we send out afterwards. Really good point now. So yeah, thank you, Millie, for posting that link. Make sure that you use that to get your CPD certificate. So it'll just ask you a few questions on the form, and then it will auto-populate into a certificate for you, and that should be emailed out to you automatically. So make sure that you get your certificate from today for attendance. Thank you, everybody. I'm aware we've run over slightly. Does anybody have any other questions that they wanted to ask before we go today? Oh, yes, yeah.
I just wondered if, there's going to be anything more like this, because this is lovely to see, because like I said, I did my placement with Jack and got a lot of support from Sam and Liz and you, Lisa. So it's really nice to see like the end game and how, I still keep telling people about how rewarding it is and the things that you guys have achieved. Will there be more like things like this that I can be invited to? And because I not just as part of CPD, but as part of a journey, it's nice to look back.
Absolutely, yeah. So the community of practice meets every 2 months on a Wednesday evening. And now that you're on the email list, which I'm going to presume most of you are because you've managed to be here today, then we'll send out those invites and keep you in the loop about upcoming events. But yeah, it's every 2 months on a Wednesday evening. So yes, don't worry, Ria, there'll be more opportunities. And that seems like quite a good place. Oh, Liz, did you have a question?
I just wanted to say well done to Millie, Jack and Sam for working so hard on this resource. It has really been such a collaborative effort, and they've gone out their way to kind of seek opinions from participants, from carers and from different healthcare professionals. And so it's not just about their learning throughout their research programme, but they've really kind of tried to get as many people's views as possible. And so I think they've just done a fantastic job. And when it is finalised, which it nearly is, hopefully you'll all get a copy and appreciate it. And please do get in contact with Sport for Confidence if you're interested to talk about it, learn with us, attend more sessions or whatever. We're really open to meeting you outside of this session.
Thank you. And thank you, everybody, for attending today. We really value your time, and thank you for coming along and learning with us today. So yeah, thank you very much, and we'll speak to you soon.
Thank you. Bye.
Bye. Thank you. Bye.
Thank you.
Everyone.
Bye.
Should we stop recording?
It's probably a good idea, isn't it?
There's a couple of people left in the call.
If I stop recording.